We know there are many choices in internet radio, and the staff and host of LA Talk Live would like to thank you for choosing the internet's hottest destination for the most eclectic sound and invigorating talk. This is LA Talk Live. We are more than just talk.
Good afternoon. Welcome to WDC Radio. I'm your host. I'm WDC. I want to thank you for tuning and listening today. As always, I have a very important conversation for you around health and wellness, more so around sickle cell trait, because that's what the platform's created for. However, we talk about other topics as well. You might catch us talking about lupus or bullying or mental health. But today, two topics that are very important. One, of course, sickle cell trait as it relates to rhabdomyolysis. I have Dr. B going to be here sharing about some facts, just some straight to the point facts about rhabdomyolysis and how it relates to the heart, because the heart is a muscle as well. So we're going to talk about that. And then I have Rhonda here, who's going to help me with this conversation around healthy eating. We're not going to give it a particular title yet. Just healthy eating, because here again it relates to my community. What'd you say? Just say what is it?
I said Sister Rhonda. How about that?
She wanted me to call her Sister Rhonda.
Sister
Rhonda is here to help me orchestrate this conversation around what I call, helping us eat healthy. Like, we know how to eat healthy, but do we really know how to eat healthy?
Not all of us know how to eat healthy.
Right. So she's going to share from a mom's point of view, and I think this is important because, again, my sickle cell conversation, people live with sickle cell disease listen to this show, and they really need to hear the impacts of what this food is doing to our bodies on a just a human being level. And I don't think we have those kind of conversations normally. So Sister Rhonda is here to help me have that conversation. I'm going to show you Sister Rhonda. Hey, there she goes. Sister Rhonda's here to help with that conversation. So she's going to be chiming in throughout the show with me for the next hour and a half. So again, if you have any questions, 323-473-3100. Feel free to call in to ask me questions about sickle cell trait, or with Dr. B, who's going to be calling in, or with Sister Rhonda here as we get into this conversation of the points that she's going to help make about the importance of your diet. All right, so it's personal. It's personal to us, to myself and to her, and we're gonna make sure that, like I said, we give you the facts and little points of view too added to that conversation. All right, so no further ado, I think this is Dr. B. Dr. B, is that you?
Yes. Hello. How are you?
Hey, how you doing, sir?
Thanks. It's my pleasure. Thanks for having me on the show.
Appreciate it. Again, thank you for your time. I want to give you the proper applause here.
Thank you.
Do me a favor, just introduce yourself to the listeners, and then we'll kind of have this conversation here.
All right. Well, I'm a doctor based in Toronto. Name's Bernard. Dr. BD. I like to go by Dr. B. Well, I'm a clinician, and I also work as an intern for sports and concussions.
Okay.
Sport injuries and concussions. So I deal with a lot of athletes, CIS athletes, and I'm also into fitness. I'm an avid fitness person, and I enjoy that, and that's my passion along with medicine. So that's a little about me.
All right. Give them your social media in case they want to find out some more fitness insights, or can you give out your social, Instagram, Twitter, whatever?
Yeah, my Instagram is Strange Fitness MD.
Okay.
Yeah. Now I got the name Strange because a couple of my friends just call me Doctor Strange. So, so I mean, that's the best I could come up with. So Strange Fitness ND. That's the Instagram,
Okay.
and that's all the social media I use. I don't use any other social media.
Okay, that's fine. Thank you so much.
Yeah, I'm on LinkedIn also, but if you Google my first and last name, you'll find me on LinkedIn
Okay.
as well.
All right. Thank you, doctor. So you and I, again, the power of social media. You and I met Instagram. I've been posting about
Yes.
rhabdomyolysis because it's important to me because I experienced rhabdomyolysis and I
Mm.
had no idea, that the sickle cell trait could trigger that secondary health issue, and then what was going on through my body on the muscle breakdown and the CK levels and the renal failure and all the secondary health issues that I have left over from that experience in 2006, caused part of my military medical retirement because I was not fit for service because of those secondary health complications.
Yeah,
including
I can
rhabdomyolysis.
imagine, in the military with all the strenuous and overexertion of exercises that could cause that.
Yeah.
Is that common? Do you see colleagues of yours who were in the army that suffered from the same thing?
It is starting to show up a lot,
Mhm.
a lot now, and again, that's why I'm here to help kind of spearhead this conversation because when it's happening, we don't know what that is, so we just push through it, and not until later on do you realize that you're having health issues.
Yeah,
So
very
I
true.
want
Yeah.
I want people to be able to notice that or pay attention to their bodies from the start, and then that way when they start to feel these kind of symptoms, they know they can start to answer some of those questions when they go to the doctor or help
Yeah,
guide
and
those
you,
conversations.
you make a good point also when you talk about symptoms because the symptoms of rhabdomyolysis are non-specific. And what do I mean by that? There's not a specific symptom you could pinpoint and say, okay, this person is suffering from rhabdomyolysis. That's why, most clinicians, we know that symptoms and physical examinations are non-specific. So once we know that the key is history taking. So we have to take proper history and know what's been going on in the person. So we have to find out the common causes and the risk factors, which we could talk about more on the shows, the risk factors that could cause, this problem. And I think it's a good point that you brought that up because, we need to ask questions and find out about the person's lifestyle to be able to come to that diagnosis of rhabdomyolysis.
Yeah.
People will come up with, general muscle weakness, stiffness, muscle aches, decreased urinary output, but that could be anything.
Right.
That could be anything. It could be, it could be drug toxicity, it could be dehydration, it could be a seizure. So, you take proper history, I think you'd be able to pinpoint on what the problem is because there's specific, like I could give you a classic case of rhabdomyolysis, like, for example, a 40-year-old male, say was a marathon runner, it collapsed during a race on a hot day. So I'm giving you key points there, marathon runner, hot day, he had a seizure, and, you probably did an EKG, the MS came, start, you give him fluids, you did an EKG, and you see some sort of cardiac arrhythmia. So that's a classic case right there.
Mm-hmm. Which is showing because it's from the cardiac arrhythmia, right?
Well, first of all, the fact that he's a marathon runner, that's overexertion of muscle.
Okay.
It's a hot day. Dehydration is another risk factor, right? Because he's losing fluid, right?
Right.
And also the EKG. Now, that's it's very people might say because the definition of rhabdomyolysis is a result of an acute breakdown of skeletal muscle tissue, right? So that's key.
Right.
So people will say, okay, what's the correlation with that and the heart? Because the heart is smooth muscle, not skeletal muscle.
Okay.
Right? So the point is rhabdomyolysis can cause an early complication of increased potassium levels. And potassium levels, whether high or low, can affect the heart and cause cardiac arrhythmia and arrest. Now, I'm not going to go into all the physiology of that, but, anybody who does the research should know that potassium level can affect the heart. So, if I get a patient coming to my clinic, and has severely low potassium level or severely high potassium level, the first thing I'm doing is an EKG to make sure he's not in any sort of arrhythmia.
Wow.
And that's what rhabdomyolysis does. It causes an increase in potassium that can affect the heart. So it's kind of like an indirect, effect on the heart.
Right.
If you understand what I'm saying, yeah.
So
that's the point.
So you and I want to just make sure I say this, because right now, more so anywhere, the CrossFit community is experiencing rhabdomyolysis a lot.
Mm-hmm.
So it's almost not becoming rare, as they say previously.
Yeah.
Because it's, again, people are starting to exercise more, and I don't think people are really going to the doctors to making sure that their health is properly set. You mentioned, we were talking about food and the toxicity of the food, and cleansing your system out. There's a lot of factors that can go on before the person starts to exercise, and then the exertion starts to trigger those secondary health issues.
Yeah. Yeah, and you're right, and that's why I would say most people are into like calisthenics and like marathon runners. Those are the kind of people that are at most risk. But I mean, it is a rare. It was known as a rare, disease per se. But I mean, nowadays we're seeing people coming in with levels of CK that are in the thousands.
Yes.
And those people have to be careful. They have to take the necessary protocol to make sure that they don't damage their kidneys and they don't go into any sort of cardiac arrest or failure. If you're going to do those exercises, because exercise is good.
Yes.
People have to exercise. And sometimes you got to push your body. But if you're going to do it, you have to do it at an adequate level, and you have to also take in a lot of fluid, because that's the key. We need to flush out that breakdown of muscle fibers, because once you exert your muscle, you're breaking it down into byproducts, and those are the byproducts that affect the human body. So you got to make sure you're drinking a lot of fluids and flushing this out of your system. It's funny. It's also a double-edged sword in the sense that just like overexertion can cause, increased breakdown of muscle fibers, no exertion, like, if you're immobile, like we call it pressure necrosis. So people who don't move, like people that are bedridden for days, can also end up having rhabdomyolysis.
Wow.
Or an increase in the CPK or the CK that could affect the heart and the kidneys.
Now you said something, Dr. B, and I don't want to brush over it, but when we first started talking, you mentioned about the heart. So just reiterate that conversation about how important it is to be aware of the rhabdomyolysis and how it affects the heart. One more time, please.
Okay. Now, it can cause a cardiac arrhythmia. And a cardiac arrhythmia is just, when you do an EKG, the heart beats, there's one beat of the heart, and you see it. It's almost like when I explain an EKG to someone, there's two ways to look at the heart.
Mm-hmm.
You can look at the heart doing an echocardiogram, which is a picture of the heart, and you could look at the heart with an EKG and ECG, which is the function of the heart, how it beats.
Mm-hmm. So
the EKG, when you look at the function of the heart and you see things like, I'm going to get really specific here. You see things like increased T waves or prolonged PR intervals or widened QRS complexes. When you see that, you look at that and you know that there's a potassium issue going on. Because potassium, there are channels, in muscle or in cells, that cause them to be active. And
Mm-hmm.
potassium can affect the channel. So if it affects that channel in the heart, it could cause it to beat abnormally, and it could cause what we call an arrhythmia. So that's the issue right there. Rhabdomyolysis can cause an increase in potassium level.
Now,
that can affect how the heart functions.
Now, potassium is something that the body needs. We know that.
Yeah.
And I don't think people really understand how important potassium is to the body, because you don't really get that just out of normal foods, right?
Yeah.
So
Well, you could get them from veggies. You could get them from bananas. But most people who are low in potassium, we tend to give them pills.
mhm.
That because it's really hard to get it from natural products, right?
Right,
The level of potassium in the body is not so high.
right.
And it's a very small range. So I mean, it's not a basic nutrient that we could get from foods or natural products.
But it's
Like
an
a,
but
an,
it's an important one though. That's the issue is it's an important one though, right?
yes, yes, oh yeah, it is.
So
And yeah, sorry, go ahead.
like no, so can you explain like I know you touched on it with the heart potassium, but can you like elaborate on the potassium and the importance of it? Is that
Yeah,
possible?
well, um, when you say the importance of it, like I mean, we can't really control um, how the levels work in the body, right? But it's just it's important that it's important to know that that is what causes the heart the heart problem
Mhm.
in rhabdomyolysis. That change in potassium that could cause the level to increase, that could cause an arrhythmia. So, I mean, that's for us to know, not for, the patient or someone who has the disease to know. They just need to know how to prevent it, and to look for symptoms that, okay, I have this symptom, and to trigger them to maybe go see a clinician or, maybe to stop working out or stop doing whatever they were doing that was causing, that's causing the problem. If you understand what I'm saying.
Yeah. So
Yeah.
I'm asking you that is like how would a person know if they have low potassium or not unless you're going to have it checked? Like,
Well, the key is muscle. Potassium goes hand in hand with muscle. So if
mhm,
you're having muscle weakness, okay, if
mhm,
you're having muscle tenderness, okay, if you're having muscle pain, general weakness, if you're stiff, then maybe you should go to your doctor to ask them to check for your potassium levels.
mhm.
So that's the key right there.
Okay.
And obviously the heart is muscle. So anything muscle related is the first thing we're thinking about is muscle. If I have a patient coming here and they're like, oh, I'm having like muscle pain and muscle weakness in my thighs, my back, my shoulders, we check the potassium level.
Does that include cramps like in cramps in
Yes,
muscle
exactly. Yeah,
cramps as well?
cramps too.
Okay.
Yeah. So, we tell them, eat food like beans, dark leaf greens, potatoes, bananas, especially bananas,
Mhm.
right? Because bananas are high in potassium. Yeah.
Okay. What else did you have that you wanted to make sure we share? I want to make sure that you have you get your
Well,
points out.
just, the awareness and, for people to understand, the disease and, read up about it and know what it is and know like classic cases, and causes, like trauma can cause
Yeah.
rhabdomyolysis, crush injuries, toxic substances, even drugs like cholesterol medications,
Yeah, that's the
you
main
know,
one that they
yeah.
when I first started talking about rhabdo, I had a doctor, describe it to me from Stanton drugs, cholesterol,
Yes,
things like
yeah,
that.
like statin drugs can cause. Those are the very most common ones,
Yeah.
right? Statin drugs and even antipsychotics. Some antipsychotics could cause, what we call neuroleptic malignant syndrome, which is also a muscle problem that could also cause an increase in CK, right? And could lead to rhabdomyolysis. So I mean, even burn seizures, it can even be as a result of genetic muscular diseases also that could cause it. So I mean, I think the main issue is awareness, and we have to be careful. Working out is good, it's great,
Yeah.
it's fun, but we have to listen to our body and make sure that we're not overworking our body because like the saying goes, too much of any good thing is not good. You know.
Yeah. And I'm like I said, I'm really having this conversation because for me, in my advocacy work, you know, even up to the NCAA, they got it where their sickle cell trait is you have to be tested to play sports, and all
Yeah.
sports sickle cell trait and sickle cell trait this and sickle cell trait that and you know, I get it, but like I said, when I went on Instagram and looked up the hashtag rhabdomyolysis, I seen people from all different walks of life, all
Yeah.
different backgrounds, So now my conversation is, okay, what do we have in common? If mine was sickle cell trait was the trigger, then what was the trigger in your case? You know,
Yeah.
and that's what I'm starting to spark these conversations.
Yeah, we need more research on that, I think, and that's another area of medicine that a lot of research should be put into, so that we can understand the disease more and we can diagnose it more. Because even the CPK level, to diagnose is not it's a highly sensitive test, but it's not specific. And when I say sensitive, a sensitive test just rules out other stuff. It doesn't rule in. It doesn't say, okay, this is it. So it's a highly specific test because you have high CPK for a lot of other things. You could have it for, like I said, you could have it for a heart condition. You could have it. The thing is, CPK it's protein enzyme.
Yeah, the protein enzyme. Yeah.
Yeah, and you could find it in the heart. You could find it in the brain. And you could also find it in skeletal muscle. So it's not specific. And that's the challenge, I think.
I don't want to put you on the spot. I don't want to put you on the spot. If this is just a way out question for me, but could you say that if a person genetically has a heart disease gene, that they are more susceptible of having that kind of complication happen, or it just really just depends on the alignment of the moon and the stars that day? Like,
I wouldn't say it puts you in line. I don't think there have been any studies done, or you can say that 100%. Like nothing is 100%. So I won't say that, but if you have a heart condition, or if you have a genetic condition that deals with the heart, then you have to be careful because anything can precipitate, detrimental effect on your heart. So, and I'm not gonna say.
I met Joyce Fairman, who was on my show a few weeks ago, and she's advocating from her life experience with her heart, heart. I don't know how to pronounce how should I say that, her heart being impacted, and so she's advocating as heart disease on a disparity level on an African American, because it affects our community as African Americans as well. So again, if you're in your family line and you don't even have any clue that heart disease or heart complications is even in your family, how would you even know to look for the symptoms?
That you're very right. I totally agree with that. But that is so true, and that's the thing about the heart. Apart from chest pains or like even people, most people with heart conditions, you're right, will die of a sudden heart attack, with no symptoms, and they probably have like a genetic disease. One being, there's something called hypertrophic cardiomyopathy, which is very common in African Americans. Just because African Americans, we're known to have fast twitch fiber muscles, and we make muscle. The rate at which we make muscle is, it's fast. So, and that could affect the heart. But yeah, you're right. It's unfortunate. Because nobody can just walk into a doctor and say, okay, I want to do a test. And,
right. Like what do you ask for? Like, if we're
and that's why I said family history is very important, as I said earlier on, right?
Yeah.
We as clinicians and, healthcare providers, we need to ask these questions, what's your family history? What's going on in your family? Do you have any deaths by the heart, high blood pressure, and look for risk factors also.
Yeah.
So I think it's more about asking questions and knowing more about a person's social history and family history per se.
Yeah, and I was talking about that with some friends, and they were like, if we don't start having our children, ask questions about our grandparents, like they won't have any kind of a history of medical background or just like life.
Yeah.
Because we don't have those conversations. So, like, how would my daughter know to ask my dad about sickle cell trait if she doesn't even know that that's even a conversation in the bloodline?
Yeah. Well, maybe we should have those conversations with the young people.
Yeah.
Yeah.
And I believe that's what Mrs. Fairman is out to do, out to bring that awareness, so you know our youth is triggered to go back and have these conversations with the parents and the grandparents to kind of pull out some of this family history and this knowledge,
Yes.
you know.
Exactly.
And I can imagine, like I said, from my point of view, if a family member dies from a heart attack and things like that, that's something you don't just have a conversation about from the other side of the pain or whatever that goes with that.
Yeah.
So I mean,
Very true.
just how do we empower our community to have these kind of talks? Is like you say, we got to bring it to them.
Yeah, we got to educate them, and yeah, I think that's the way to go.
Yeah,
More education, more awareness, and talk about these things.
yeah.
Yeah, even my dad passed away 10 years ago. 10 years next year, so 9 years ago from a heart attack.
Oh wow.
So, I'm living this too, and obviously this is something I have to communicate or educate my own kids about, and
Yeah.
even myself about, and make sure that I'm in a good condition. I'm getting checked, on a yearly basis, twice a year. So,
Oh wow.
yeah,
Yeah. So this is direct, kind of part of your life.
yeah,
Yeah. Wow. Wow. And
yeah.
yeah, I mean, so for you, like, how did you handle that? You know, the passing of your
Um,
dad and the heart, knowing that it's from heart, from the heart, and then now you gotta do it. You gotta literally go in yourself now and go have these checks.
yeah. Well, it is life. You have to do what you have to do. That's the main thing, and that's the thing, because he was a healthy guy, tall, skinny, he ate well, um, never had any pre-existing medical conditions, and all of a sudden, just passed away. And that's the thing, and that is definitely, I would say, there's a genetic factor that plays into that, and
Yeah.
that's also what I try to tell a lot of my patients, who suffer from like diabetes or, high blood pressure,
Mhm.
high cholesterol, things that could affect the heart. That listen, you have to make sure that your lifestyle is proper, and you're taking the right medications and you're taking care of yourself, because you know um, the complications of high blood pressure, or the symptoms of high blood pressure, is a heart attack.
Wow.
Like, you're not going to be sitting down and, it's not like, when you have a cold and you have the flu, you're coughing, there's runny
Right.
nose and all that, and you can see the symptoms.
Right.
The symptoms of these heart conditions are detrimental and terminal.
Yeah.
So, you don't want to experience the symptom before you come into the doctor, or in fact, you don't come into the doctor, you're in a coffin. So, even though you don't have symptoms, you have to make sure that you're continuing to take care of yourself, and you're continuing to do the right things, and you're taking your medications, because, some people will be like, okay, I feel good. My blood pressure is normal, or, my sugar is normal today. I feel good, and I'm just going to eat whatever I want to eat, or I'm not going to take my medications. But, we try to hone that into them, because the symptoms of heart conditions is a heart attack.
Mm-hmm.
You know what I mean? So, it's not like any other thing. So you have to make sure that you don't end up where you're getting that symptom. And that's why you have to be really careful, because the heart is very sensitive.
Yes.
Yeah.
And you say you do work in sports medicine as well, right? So
Yeah, well, I deal with, some patients with concussions,
Yeah.
mainly concussions and like spinal injuries.
okay.
Yeah.
As far as well, you mentioned rhabdo. There's not really a way to. So I guess what I'm getting at is, and I'm gonna say this because I'm a sickle cell trait advocate, is that I get the NTA is mandatory screening for the sickle cell trait, but there are also other red blood cell conditions that affect the red blood cells, like thalassemia and C trait and D trait, that I've met people who have had the same kind of experience I've had with rhabdo, but with thalassemia trait as a trigger.
Hmm. Uh,
Because the oxygen carries, through the body carries it, so it takes to the muscles, right? So if there's a red blood cell gene in there, I mean, it's possible for that to affect, the muscles if because it's
Yeah.
carrying the
Yeah. Well,
oxygen through.
I'll have to do a lot of research on that and talk about that because,
Yeah,
I'm, sickle cell and rhabdo, the red blood cells, hematology and the heart.
it's a lot.
It's
It's a
there's a
lot.
lot that could happen,
Yeah.
and I definitely have to read up on that before I make any
Oh yeah, yeah, yeah,
comments.
yeah.
And
No, I'm just relaying that as far as my advocacy work.
yeah.
They got sickle cell trait pinpointed as a trigger for the football players and for the student athletes.
Mhm.
That possibly triggers rhabdo. But there's a whole community out there of people with thalassemia who play sports who could have that same kind of trigger to rhabdomyolysis is what I'm saying that
That's
I've met
interesting.
I've
Yeah.
met people with I met an army officer that
Mm.
experienced the rhabdomyolysis with he has thalassemia trait. So
That's very interesting.
yeah, it's a lot, and like I said, I'm not, I don't want to put you on the spot. This is just the conversation that I've been having in the community and with other people as I share about sickle cell trait and rhabdo, because they want to say that sickle cell trait is not by itself a trigger to sudden death.
Yeah.
That the rhabdo, you know, is the culprit in that, I guess, in that combination.
Mm.
So I'm just looking just to for people to hear this message and then to think for themselves and do their own research and
Yeah.
find out
Exactly.
their own health. Because I'm not a doctor either. I'm only sharing my experiences and other people's experiences, but we're related as human beings. So there are some secondary health complications that are possible with having sickle cell trait is what they're which is what
Definitely.
yeah,
Definitely.
you guys, that's a fact.
Yeah. Definitely.
Yeah. All right. Any more information you wanted to share, Dr. B? I know
Um.
that you
I
that you
think
found.
I think we covered most of it.
Okay.
I think we covered most of it. Yeah.
So
Unless you have. Sorry. Go ahead.
with rhabdo, again, the people that I've been meeting with CrossFit, uh, with rhabdo, their extremities have been swelling, so they'll have either swollen abdomen or swollen forearms, or legs because of the renal failure, because the kidneys can't filter all that CK levels. You know, that's what I've noticed. As
Yeah.
far as with rhabdo.
Yeah. Definitely. I mean, once you start retaining water because your urinary output is down, then you start to see signs like that, and that's another thing to watch out for. But I mean, in relation rhabdo with the kidneys, I would say it's more of a late complication. It's more of a chronic. You've been doing this thing for a long time. It's not an acute reaction that will happen like with the heart.
Right.
It's something that's more chronic that happen over time. Where you start having, the decreased urinary output and the problem with the filtration of the kidneys, and which eventually leads to acute renal failure.
Yeah.
So yeah, when you say you have seen people with that, it's possible.
Yeah, because
Totally, very, very possible.
the toxins fail the kidneys because they can't
Yeah.
the kidneys won't function properly. So the water
Yeah.
they start to retain water and it settles in those extremities. And
Exactly.
then that's how they figure out, okay, something's wrong with me.
Yeah.
And at the same time, that if you're not aware of what that is, which is the rhabdo, then like you say, your heart can start to have, issues.
Mhm.
And so that's just I'm just want to relay that to the people that have that experience that, or to be aware of that swelling of rhabdo. You got to have those other your heart tested and things like that when you go into the hospital for care because
Exactly. Very true. Yeah.
of what that rhabdo can cause. I guess that's what I'm trying to make a point at.
Mhm. Yeah. You're right.
Yeah. All right, Dr. B, man, thank you.
Okay, thank you so
No,
much
thank you for
for
your
having me on the
time.
show.
Yeah, thank you for your time and your information. And I
Yeah, we
really
should do this
appreciate it.
again.
Yeah, for sure.
Yeah,
Anytime we'll be in communication, and as I do this research on this rhabdo, man, and this community of people that has experienced it, um, we've gotta bring some awareness to it. I have to. Like I
yes.
experienced that.
Yeah, and I have to
Uh,
say, continue the good work. It's good to see people like you out there that is trying to educate people and share the knowledge and the wealth. So it's good. Thank you so much for doing that and keep up the good work.
Thank you. Thank you for your time.
Yes. Take care. Bye
All right,
bye.
you too. Thanks. All right, this is WDC Radio. I'm your host. I'm WDC. Again, I want to thank you for listening in. Very important. Like I said, I experienced rhabdomyolysis. I had no idea. I exercised my whole military career. Never had any problems until that perfect morning, that perfect storm, where my sickle cell trait triggered and the rhabdomyolysis triggered, and I had renal failure. My CKs were rising. I was dying on the inside and had no idea that they thought it was just heat stroke, dehydration. And come to find out that that just not was the case. That I was actually having some health issues, and luckily they were smart to flush my system out with IVs. And so the secondary health complications that go with that, I have double vision, I have fatigue, chronic fatigue now, muscle joint pain, arthritis, a lot of things that happen from those triggers. So very important. Again, I'm going to continue to bring this message to the community as much as I can. If you have rhabdomyolysis and you want to share your story on my show, whether you're locally or out of state, we can set up that call here in the interview. And I would love for you to come and just share your experience so we can start to get these conversations going so people can start to listen to their own life and how this rhabdomyolysis is affecting the CrossFit world, the military, college students, student athletes, just regular people are being affected by rhabdo in their attempts to just be fit. And it's a health issue. Rhabdomyolysis is serious. It's not as rare as the medical books has been saying. It's starting to show up a lot. So